can't control that.
Good morning. I have with me a special guest today, and I want to make sure that this is showing. Um, so I have with me a special guest today, Stacy Grau. And Stacy has dedicated her career to applied health research and global public health with a master's in global health promotion from George Washington University. She has led significant projects addressing diabetes prevention, malnutrition, infectious disease management. Her most notable work includes the Healthy Study, which aimed to prevent type 2 diabetes in middle school youth, revealing that regular exercise can reverse prediabetes. That's huge. Stacy has also worked on initiatives in Bangladesh and Mozambique to combat malnutrition, in Afghanistan to prevent bio threats, and Nicaragua on HIV, AIDS prevention and care. Passionate on systematic health issues, she advocates for preventative health education over the current disease-focused medical model. Stacy also raises awareness about the addictive nature of processed foods and shares her personal experience with sleep disorders and her family's history of type 2 diabetes. With her global perspective, having lived in 12 countries and traveled to over 53, Stacy brings invaluable insights into the future of health and disease prevention. So thank you so much for coming on, Stacy. We have been friends for years, actually since high school. I met her mom on a chairlift when we were skiing one time, and we have been close friends ever since. After they had moved from Canada to where we were living in New Mexico, we were roommates in college, where she met her husband. And I've traveled to many locations to see her, including New Zealand and Bangladesh, Nepal, and Nicaragua. So, where are you joining us from, Stacy?
I'm joining you today, Amy, from Colombo, Sri Lanka, where I currently live.
Okay. Wow, that's incredible. All the way on the other side of the world.
Yes, well, thank you, Amy, for having me today. I really do appreciate your time with me.
Absolutely. Okay, well, I wanted to go ahead and jump in. Can you share what initially drew you to public health and research, particularly in diabetes prevention?
Well, I learned about the field of public health through an honors professor in college. And I knew then that it was what I wanted to do, as I could find a way to blend that with my passion for travel. So after I graduated from undergrad, I got my first job in the field of public health as a research assistant at George Washington University doing clinical trial research.
Wow.
And one of the most prominent areas of research at our center was in the field of diabetes. And I was very lucky enough to be assigned to one such project where I learned about the difference between type 1 and type 2 diabetes, as well as the definition of prediabetes. So type 2 diabetes used to be called adult onset diabetes. However, in the study I worked on, children as young as 6 years of age were being diagnosed with type 2 diabetes, which was alarming and demonstrated the need to accelerate research in the area of prevention.
Wow. So, and because we always think of if they're a child and they have diabetes, that for sure they have type 1, but your study found there was a difference. Okay, wonderful. The diabetes prevention program study was groundbreaking. What was so groundbreaking about it?
Yeah, so the study found that just 150 minutes of moderate level of exercise, such as walking per week, could reverse prediabetes. So the group who made diet and exercise changes had much better results than the control group, and the group who was given the drug metformin. So that study was the cornerstone to many other studies and health programs that exist today, including the plan utilized by PartnerCo and PartnerCo droppers.
Okay,
Um,
wonderful.
like,
Okay.
like probably many of you, I was introduced to the drops by Amy at PartnerCo, and I've read some of Dr. Strand's books and listened to Dr. Strand and Dr. Crystal's talks. And it was important for me to talk to you all today because while I am passionate about nutrition, you all likely already have a good basis of knowledge on that side. So I wanted to share the importance of moderate exercise in reversing some of the negative effects many of you suffer from due to our modern Western diet.
Oh, wow, amazing. So even at those young ages that a lot of the children in the study were on metformin, is that correct?
So actually, the study I'm referring to was the diabetes prevention study. So that was a study in the first year that I was working there. Those results were coming in by another study that was done on adults who had prediabetes. My study was with the children, but that first study was the groundbreaking study that really basically cemented all the work that's done today based on those amazing results that happened, just about the 150 minutes of exercise per week that can reverse prediabetes.
Wow, that's incredible. Why do you think this message isn't widely emphasized about you
Um,
doing the 150 minutes per week?
I think as someone who tries to learn something new every day, I know that breakthroughs and discoveries are happening in clinical trial research every day, and not just in health, right? In every area with AI and technology, so many areas are developing so fast in this day and age that it can be really difficult for important and key information to reach the masses. Especially in an age where there's so much misinformation in the media and just overall general skepticism.
Yes. Okay. Wow. But I think we should be encouraging, I mean, not only our youth, but our adults to have set those goals, right?
Right,
Okay.
absolutely.
So you're
Absolutely.
passionate about the lack of preventative care in modern medicine. What changes would you like to see in the healthcare system? That's a pretty broad question.
Amy, you've asked a question that I could spend hours talking about. Um, and it can be easy to think that we're powerless to change the system. However, I'm a strong believer that collectively, we can demand change and we can seek out other alternatives because we are not getting better from current care or from our treatment providers. Our current system will be forced to make changes in how it operates.
Okay, great. Why do you think the medical field remains so focused on treating disease rather than preventing it?
Well, there's no profit in it, right? Our medical system,
Sadly.
our medical system makes money off of pharmaceuticals, like Ozempic is not just used for weight loss. It's one of the primary medicines for treating diabetes. And with diabetes, if left untreated, or not properly managed, it can lead to high blood pressure, heart attack, stroke, and Alzheimer's. Amongst the medical community, Alzheimer's is even being called type 3 diabetes. So more disease, more pharmaceuticals to prescribe, more doctors' visits, more labs, more tests, all of that adds up to profit for big pharma and for hospitals.
Wow. Can you talk a little bit more about what you said about the type 3 diabetes?
Yes, actually, and I can speak personally on this. So my mother was diagnosed with type 2 diabetes, and I did notice that she was really exhibiting symptoms of early Alzheimer's. And so that really is something that they're doing right now in the same center that I worked on all those years ago. Same statisticians and same uh, clinical trial specialists are working on studies now that are really looking at Alzheimer's and its relationship to diabetes.
Okay. And so are you saying that if you can prevent just going down that road at all, that that can make a difference with those memory issues in general?
Memory issues, and remember, diabetes can lead to high blood pressure, heart attack, stroke. And that's typically, Amy, what people who have diabetes end up usually dying from is, something like a stroke. So again, it's just really key that it's not too late at any point. Even if you end up with diabetes diagnosis, lifestyle changes like just changes to your diet and to exercise can really help to reverse some of the damage. that has been done. And that's the positive message, right, Amy, is that we all
Right.
can make changes for the better to our lives, and hopefully, we'll live long lives because of it if we can make those changes ourselves.
Absolutely. And I love that you're passionate about that. We can talk for hours on all of that. Um, how can individuals become their own health advocates in a system that often overlooks prevention?
I think, demand to be heard. Don't just respond to the doctor's questions. Make sure you tell your primary care doctor about everything that may be off with you or your body. Otherwise, they will only treat you for that one thing. Too often, most of us are suffering from multiple issues, and your doctor can't do anything about it if they don't know what is going on with you.
Okay.
And then I would say, secondly, if especially if you don't feel like your doctor has time to listen, or has time to get what you need out of them, don't just assume that they're your one point of care. There's a wide world of holistic approaches that you can seek out. In public health, we call it complementary medicine. Integrative medicine. Integrative medicine refers to the fact that you can take Western medicine and your primary care doctor and anyone else that you might be seeing, and add in additional practitioners to make it be a holistic approach rather than only focusing on your disease or that your one issue at hand. And so I think, I don't know if any of you have heard of the term. I currently live in Sri Lanka. I see a naturopath. I go to and it's called the Nature Mediclinic. And what my provider will do is he'll sit down with me, and he will basically do a holistic questioning approach with me and find out what's going on with me. And then he will treat me for both mental and physical ailments that may be, I might be dealing with at that time. So if you want to look into, naturopathic health care providers are available in the United States. You can look for one in your area, or via telehealth via the American Association of Naturopathic Physicians. And they're called NDs rather than MDs. And those NDs, they go through a 4-year accredited doctoral program, and they must pass a licensing exam. And currently, licensed NDs can practice in 22 states in the United States. So, hopefully you can find one in your state. I know Colorado and New Mexico are 2 states where there are licensed NDs that can practice. And hopefully, if they're not available in your state, maybe you can do a telehealth exam with someone in one of those 22 licensed states.
Okay, thank you. Um, okay, so one of the things that I know we have talked a lot about, and we both gone on our own journeys. We watched each other go on our own journeys with, high school eating and college eating and everything. What should people know about processed foods that maybe they have not already heard? What role do food chemists play in their addictive nature?
Well, yeah. So Amy, I think everyone kind of knows, oh, just all they've heard is that processed foods are bad for you. Well, obviously, even though I'm a practitioner in public health, it doesn't mean that, all of us don't eat processed foods. Any food that's packaged is processed. So, I think it's important that we let you know that there is a career or a field out there called that a food chemist does play, and they are the ones who basically develop these menus or these formulas for these processed foods, because their goal, of course, is to make it yummy and delicious, right? So that you buy more and more of their products. And, a lot of those substances that, of course, they use, they're preserved to allow the product to last a very long time. And people know this. I think most people know that about that, but they haven't really realized that, they are basically paid to kind of give you that addictive nature to those products. And, I think most people don't realize that that is one aspect that they've figured out. And they get paid a lot of money, of course, to make those foods be attractive and make you just want to keep going back to that second or third bag of chips or crackers or whatever it might be, you know? So,
Or to stop.
yeah.
Absolutely. Okay, well, thank you. And I know a lot of that can be very addictive and it's hard to get off of. And so I know we are both passionate about helping people eat whole foods and real food that is not packaged and processed. So why is that so important for health?
Well, you know, there are steps that families can take to reduce processed food consumption and make healthier choices. You know, you can prep and cook and freeze your meals for the week, you know, to save time. So, you know, maybe pick you know, half a day and make it a family outing, you know, get everybody involved to like you know, just do lots of the chopping and prepping and cooking. And you know, sometimes you know, in the wintertime, not fresh fruits and vegetables are available, but you know, it's still important to get your veggies and you know maybe your frozen blueberries and things like that. So, you know, just try to save time. I know everybody's you know worrying about the time that it takes to eat and cook and make meal planning for whole foods, but then just try to you know give yourself a reasonable goal and see how much you can do and just in terms of meal prep, just one day a week, and maybe make it a family affair. And then the second thing I would
Great
say
idea.
is there is an app called Yuka out there. I'm sure there's other apps like Yuka, but that's the one that I'm familiar with, and that when I am in the United States, I use it. It's called YUKA, and you can download that app and on your phone and scan barcodes of any packaged products in any store, and it will rate them from very poor to good or excellent. And you know, they'll help you to make better choices of the packaged foods that you buy.
Absolutely. The other thing I wanted to just throw in there is I know both of us have really enjoyed the using the EWG, right? The Environmental Working Group
Yes,
website. Do you have a
yes.
second to talk about that? If
Yeah,
we're
so
trying to avoid
I started
toxins?
to use, yeah, I started to use the EWG website mainly for, I was thinking about, oh, you know, what toxins do we basically put on our bodies, right? Lotions and creams and shampoos and things like that. And so that's where I kind of discovered the environmental working group for that reason. So for sunscreens, for example. That was the very first thing I thought, you know what, I use sunscreen every single day because I want to protect myself. I want to get my vitamin D, but I also want to protect myself from skin cancer, especially after being from New Mexico and living in tropical countries, right?
Yes.
And so I put sunscreen on my face, you know, lather up every single day. And so I was like, well, I better make sure that the sunscreen product that I'm using every day on my skin is one that's not toxic and is as natural as it could be. And so that's how I started using the EWG group and that with EWG, they put ratings, right, Amy? 0, 1, all the way up to 10, 11, 12. I think 10, 11, 12 is 9 are like in the red, you know, red bad category. I think the
Right.
closer to
Avoid.
the 1 is a better
Run
number.
away.
Yeah, yeah.
Yes. Exactly.
Yeah.
Exactly. One thing I know you briefly mentioned that you have used the slenderized drops. Do you mind just sharing kind of what that's done, what impact it's had in your life?
Yes, so again, it's really interesting, right? The slenderized drops, you know, are really probably everyone's taking them to get weight loss. And of course, that first drop has, you know, that one component that is active for the thyroid, which is really interesting, right? To keep make sure your thyroid is, if your thyroid is working, functioning properly, right, then you're going to be able to burn calories and process foods faster. So yeah, I did notice that I definitely did lose the small amount of weight that I wanted to lose on the drops. But to be honest with you, Amy, just like everyone else, it's not only about the weight loss, right? That's nice. And that's sort of like an external, you know, you feel better about yourself. But the homeopathic properties of the drops, of both drops, even the second drop, especially there's just so much beneficial in those. There's just so many, you could never, ever, you know, take the time every day to grab every single drop of items that are in those drops all together combined that work on stress and your emotional, calm and balance and sleep and so many different things that it helps with. And so many people, especially, women in menopausal age. I mean, so yes, I've really enjoyed. I was telling Amy before this call that, I'm kind of getting ready to leave and move out of Sri Lanka here pretty soon. And so I've been pretty busy with that, packing up and organizing myself. And I've kind of had to like lose track of my drops and not be very so good at taking them for at least a few weeks on end now. And I told her, I said, that the effects of those drops are still there. I'm still maintaining the weight that I had. And so I kind of related and remembered Dr. Crystal saying that that's what she does, right? She will, if you're trying to save money, you don't have to be on the drops forever, but you can always come back to them. We know just when your body tells you that, you need it. And who knows? I don't know about you, but I have a lot more. I'm very sensitive to caffeine. So I have a lot more of the second drop than the first. And I feel like, what, I can, give some of that to friends just because there's so many elements in that one drop that have that function for energy and focus, and that it's beneficial, and we can take that whether or not we're taking the full program at the time. So it's great, Amy. I love the products.
Oh, good. Thank you. So I wanted to delve into a little bit about the fascinating places that you've lived. You've had such an amazing life. So you've worked in countries like Bangladesh, Mozambique, and Afghanistan. Can you tell us a little bit more about some of those places? And also, I also wanted to highlight that when you went to Afghanistan, you followed your husband there, and not many people make that choice to go live in Afghanistan. And you worked hard to get over there and you had some amazing experiences. So if you don't mind touching on some of those countries and kind of what you learned about their lifestyle, their stress. I mean, obviously they were under a lot of stress in Afghanistan, and how those things impacted their health.
Well, I was going to say, honestly, with Afghanistan, and you all probably, have heard and seen this on the news, but I was very fortunate to go and work both in health and education. So the thing that really struck me the most, I worked on a lot of projects and programs that Amy mentioned when she introduced me, but I wanted to really kind of say that, the thing that was most endearing was just the community resilience and perseverance was for girls' education, right?
Wow.
So, obviously with the Taliban, the girls are not allowed to attend school. They're basically not allowed to attend school from a very young age, which for us, I think we can't even fathom that. We can't even fathom
Yes.
that. So, to be honest, talking to teachers, talking to parents, who had girls, right? And learning and hearing from them about how important it was that they were risking their safety, and, teachers were risking their safety, parents were risking their safety, right? To get their girls educated, and to listen to the girls and talk about how much no one was going to force them from not having an education. So that was so inspiring and so memorable of a memory for me. So of course, Afghanistan will forever be in my heart from just being able to work in girls' education. So that's probably the most memorable memory, of course. And then, Bangladesh and Mozambique, I worked in nutrition, both in maternal and child health, and obviously it's interesting having started my career working in type 2 diabetes to then go and work in places like Bangladesh and Mozambique and see severely malnourished children, and learn about how to save lives. We saved 534 children's lives in Mozambique through our
Oh,
program
okay.
over 4 years, 5 years, 534 children from severe and moderate malnutrition. So lots of things to be proud of. Of course, I didn't do it myself and I'm alone, but just to be part of the entire network of people who helped do those programs. In Mozambique in particular, they love to use song and dance, which is very, very powerful, motivating to teach others about health and nutrition, and to teach community members. So it's really inspiring to see how they incorporate song and dance into learning. So Yeah.
Right. Oh, that's so fun. So here in the US, we tend to be overnourished, right? And to deal with the malnutrition, what kind of strategies did you use to help, especially but families that were in those situations?
Well, so, obviously there's a whole, and it's, my learning started in Bangladesh. So there's the whole nutrition field in terms of malnutrition is really focused on survival, child survival, we call it. And, the, for any child, who's malnourished, the success rates in their, and from saving them from dying is really, between the, ages of 0 and 2. So the
Wow.
younger that they're, and so what does that tell you? A lot of it tells you about breastfeeding, right? And breast milk. And I think as a mother, Amy, that, um, there's a lot of things like, breast milk, prevent, if you, the longer someone's on breast milk, a child's on exclusive breastfeeding, it also in the United States, right, that you can really avoid, things like allergies to food and allergies to environmental factors. And so really that was one of the biggest, things when we're talking about trying to prevent death from malnutrition, and is one, making sure that the mothers themselves are malnourished. So one of the things that we found in working in those communities, right, is that they're very male dominated, male centric, family. So they're taught, the woman of the house is taught that she cooks the food and then she serves the husband the food, and the husband gets the largest portion of the food that they can afford at that time. And so a lot of it was around really educating the fathers that when the mother is, breastfeeding, and when the children are of a certain age between 0 and 5, that,
Right.
the mother and those children 5 and under really needed that nutrition, first and foremost, and that kind of cultural shift had to change.
Okay. Wow. That's incredible. That must have been challenging.
Yes, no, but it's a great challenge though. It really is, to be able to see that you break through there. It really
Right.
is. Yeah.
Absolutely. Oh, wow. How amazing that is to see a difference when you're actually seeing lives that are being saved. That's
Right.
incredible.
Yeah.
So, on a personal level, how have your own experiences with sleep disorders and a family history of diabetes influenced your approach to health?
Yeah, so I would say when I was working I actually didn't even talk about this, but I actually spent 2 years in Djibouti. And I at that time that I was working in Djibouti, again following my husband, I really did feel that I was that the food sources that I had access to in Djibouti, that I wasn't getting nutrition. Just a feeling. I never did get health testing done. I couldn't really get health testing done in Djibouti. But I did really feel at the time, that I was really suffering from a lack of some kind of nutrients. And I think also it was really affecting my ability to sleep well as well. Went back to the US and did a whole bunch of testing. And I discovered, that I was diagnosed with a mild case of sleep apnea. And so, I really had to really look carefully at, for example, at the time, I was living in Tampa, Florida for about 5 years. And I just was going through everything that I was, drinking during the daytime, and even eating. And I was just realizing, oh, wow, I can't believe how much caffeine is in these drinks that I'm drinking. And, I wasn't drinking a lot of coffee. I'm not a huge coffee drinker, but, just different things that I was eating and drinking on a daily basis, kind of a more regular things that really had a lot of caffeine in them. And that, especially for someone like me, and Amy and I both were both very sensitive to caffeine. And the later in the day, I would actually test myself, if I was like finding out that I had items of caffeine that I was ingesting after, 1 or 2 o'clock in the afternoon, it was really affecting my sleep, pretty poorly. So, you know, fast forward, my mom ended up being diagnosed with sleep apnea. And, I know my mother very well, and I knew she was not going to, the only treatment for sleep apnea, uh, in the Western medical system world right now is using a a CPAP machine. And so I knew, and I actually still today I use a CPAP machine, and I actually love my CPAP machine because my airway, I can breathe so much, get much more air, and I do feel like it does help me sleep much better at night. I do other things to be able to like I go out and make sure I have some vitamin D and I get some sunlight to be able to sleep better for just like 20 minutes every day. But I knew my mom wasn't going to be able to wear a mask because she just doesn't like anything on her face or her head. And finally fast forward, and she'd been diagnosed with diabetes, and she had high blood pressure and stroke, had strokes. And she finally did go to a sleep doctor, who was really the best provider she's ever had in her whole life. And this woman, sleep doctor, handed her a pamphlet and said to her that untreated sleep apnea can lead to diabetes, high blood pressure, stroke, heart disease. So all of the things that she was suffering from, right? So she basically had done nothing about her sleep apnea issue for many years. And she came to me and said, but Stacy, I didn't know that it caused all of these things. If I had known it caused all of these really serious illnesses, then I probably would have, I wish I would have gone 5 years ago. Maybe I wouldn't have gotten any of those, the things that I have now.
Right.
So she is using her machine now, and also just doing things like Tai Chi and acupuncture, and it's really helping. All of these different elements really do help us in our sleep patterns.
Okay, wonderful. I have another question for you that I'm going to kind of throw at you. So I've known you when you were a teen, you did have issues with asthma. And I know
Mhm.
you've gone through a whole journey with asthma, and I know you've used some homeopathy with that, and you know how passionate I am about homeopathy. So I was wondering if you could talk a little bit about that.
Yeah, sure, Amy. So I think for me, I grew up with pets, and pet dander is a real trigger for me in my asthma. And I actually I don't have any children, and I actually don't have didn't have a pet in my adult life for a very long time because of my allergies to animals. And then finally, I discovered that I own a miniature poodle, and I didn't have any allergic reaction to her because they have hair and not fur. And so, but now by having a dog, I love animals, and I always, offer to, people who friends who mind my pet, I offer to mind their pets, and of course their pets are not hypoallergenic pets. And so that's probably what Amy mentioned, is that, when I've minded, I had one lady who needed me to mind her pet for about all over summer months, while they transitioned from one country to the next out of Sri Lanka. And I was telling Amy that I was really suffering, and I was using my inhaler a lot during that time frame. And so Amy did give me some homeopathic remedies, and honestly, I can't tell. She's the expert. So can you remind me again, Amy, which is the ones that are good for asthma?
Well, I think we gave you the calcaric carbonica and then the Cali carb and
Yeah.
probably some others.
Right. And I
Ipecaca,
just, the only reason I don't know the names of them right now is because I haven't had to take anything in a really long time now.
which is
Because like
amazing.
many of the homeopathic remedies that Amy has recommended for my allergies, for example, I followed her regimen for several months for, like, preventing allergies. And then, I could stop. I didn't have to take any more because, they worked. So yes, so obviously all of those things are related. For me, my asthma, especially with the minding pets that were sleeping in the room, even though they're on the floor, they're still in the room, and it just
Right.
really, her giving me those homeopathy meds really were helpful, because my asthma triggers would definitely be much worse, in the close quarters and before bed. And obviously that not being able to breathe very well and have, sneezing and runny nose and itchy eyes is obviously going to affect your quality of sleep.
Right. And I remember you said something about when you went home, you usually had worse allergies there and it wasn't as bad as before. Is that
Right.
correct?
Yeah, so in that, separate from the pet dander and pet allergy or pet allergies, um, Amy knows that she and I grew up in Ruidoso, New Mexico, and she knows that when I go back home to visit my mom in New Mexico, I suffered just horrifically from allergies, almost all times of the year there. And so finally, I just told her, I said, I know I've got to do something that I can like take for 3 months or whatever to like prepare myself to be able to go there, because when I'm there, I mean, I'm just like absolutely miserable. And so, yes, I did do that. And it did help tremendously. It doesn't take it completely away, but it definitely helps take the level from being really serious and non-functioning to, very mild sniffing and sneezing every so often. So huge help.
That's huge. Okay, that's
Huge help.
amazing. Okay,
Yeah.
so you have traveled. I know you've traveled to over more countries than I have. I've been to about 50 something, and I know you've traveled to at least 50 countries and probably more. And you've lived in at least 12 countries. Has seeing the world shaped your understanding of health and well-being?
Um, well, I think there is something to gain from the way that different cultures approach health and well-being. There isn't just one way. I think that's one of my issues. If there are even, Western doctors and Western nurses who say that there's only one way, and it's the Western medical way, approach, I think that's, everybody should really be open to more than one way, and seek out different approaches and combination of things that works best for an individual. Not there isn't a one solution for everyone, right? What we love to hear about is someone who tries something and say, hey, I tried this, you suffer from the same thing, why don't you try it, right? And that person may not have the exact same outcome as that first person, right? So we're all, uniquely made up, our DNA. But I think that's one of my biggest messages is, as long as we're open-minded and we're willing to realize that there are solutions, that, we're a fairly young country, right? America is. And, there have been, obviously, Europe is much older than us. And then beyond that, right, there are other cultures, Eastern medicine, that have been, practicing, their versions of medicine for thousands of years. And so, it may not be for everyone, but sometimes what we find, right, Amy, is we find people who are just desperate because they have tried everything that they possibly can, and they're not living their life to the fullest, and they're really suffering from, living a good quality of life day in and day out, and they're willing to try anything, right? So if you just go into something that maybe you were really hesitant about before, with an open mind and thinking, I need to give it a shot because nothing's worked for me so far. And I think that's what's really given me that perspective understanding, is seeing that in all the places that I live, and being open to trying new and different things. That's what I would say
Probably
for
lots of
sure.
different food too, which is fun.
Yes, yes.
Okay, so my last question is, and I just want to tell you how grateful I am for your time
Sure.
as we're closing. And I know it's late at night for you, so thank you for doing this. But finally, what is one piece of advice you would give to someone wanting to take control of their health today?
Well, that is definitely a great question, Amy. And I would say that, give yourself grace, it doesn't help to beat yourself up that you're, not, if you fall off the wagon, if you're like, I had that piece of cake, or, I didn't exercise today, or I haven't exercised in a few days. I mean, look, we're not perfect, right? So that feeling bad about yourself and being negative is not a helpful attitude. Like, every single one of us, don't compare yourself to others. Don't go, oh, Amy and Stacy, they've got it all together, they've got it all figured out, they're healthy, their weight is good, all those things. No, every one of us, we all have our nemesis. We all have our, things that are bad habits and things that, we sometimes fall back into. No one is perfect. So don't be hard on yourself. Just give yourself grace, and don't assume that everyone else has it all figured out, and allow yourself to enjoy or indulge in your favorite foods every once in a while. And just because this is a lifestyle change, right, Amy? We hope that people by now know that there's no one quick fix. There's no magic diet, there's no magic pill, there's no Ozempic shot, a one and done. You're just gonna just make changes gradually to set yourself up for success, right? Don't try to say, tomorrow I'm going to start something like food wise or exercise wise that is so, challenging compared to where you are today, right? So, 150 minutes of exercise, for example, a week. I don't know if any of you have heard about the 10,000 steps per day. Well, that's crazy. I hate hearing that number because I feel like that number would stop anyone from even trying. I mean, 10,000 steps a day. Do you know what 150 minutes of exercise a week equates to? It equates to 15,000 steps, but that's per week, not 10,000 steps per day.
Right.
And, it doesn't, exercise does not have to be expensive. You don't need a gym membership. Walking is one of the best things you can do, that especially if you don't have any, feel like you're out of shape, that you can do and not have any, aching pains for it, or find an activity that you love to do. My husband, he hates the gym, he hates exercising. He found a love for pickleball, and then now he just loves it, and that's what he does to get his exercise and his minutes of activity every week. He's now over 150 minutes a week, so he's seen huge numbers. All the numbers that he had in terms of cholesterol and his liver enzyme and all these things have totally dramatically reversed with that level of exercise and changing to a more mostly plant-based diet. So, doesn't have to be expensive for exercise, right? For example, you don't have to have even an Apple Watch. Maybe you don't have very much money. You don't have to buy an Apple Watch. Pedometers, I don't like having anything on my wrist anyways. You can buy a pedometer for like $3, less than $5.
Wow.
And, make sure that you calculate. Don't assume, make sure you calculate the 10 minutes that you spend vacuuming. You count that as exercise. They did this one great study of with people housekeepers who cleaned hotel rooms. And they asked all of them, they said, do you exercise? And all of them said, I don't have any free time to do any exercise. I don't exercise at all. I have no free time. And then they told them that, do you know that you're exercising all day long as part of your job? You're getting tons of exercise.
Right.
And when they heard that and they realized that they were actually getting more exercise than most people did because of the work that they do, they really shifted their mindset to being like, oh, I only work in this job doing X, to, wow, I'm really actually through my job, um, you know, improving my health. And they were like, do little things like to do a squat here and there, or like do a little bit of muscle action with their arms when they were doing, vacuuming or something like that. And the study saw how much, change in terms of their muscle structure and their, overall changes in health because of how your mind is reacting in terms of, I can take control of my own health and I can make little steps each and every day to do better and be better. And if you fall off or you don't do something for a couple of days, that's fine. Just pick yourself back up and get back at it.
Absolutely. Well, you have been my exercise and health buddy ever since we were 15. So you're the one that first took me to a gym. I'd never even been to a gym before. And we used to we'd have to get up at 5 something in the morning and go work out together. And we've done aerobic classes together. And even with you across the miles, we've always compared, oh, what exercise are you doing now? How are you eating now? And we're always encouraging each other. So I wanted to thank you because I think everybody needs an exercise and health buddy, even if they live
Yes.
across the ocean. You can still keep each other accountable and encourage each
Ex-
other. So thank you for being that for me, Stacy.
Oh, thank you too, Amy. We keep each other accountable, right?
Absolutely. Well, thank you so much. I know you need to head to bed, so thank you. I'm so grateful for your time and
Thank you so
just
much,
your
Amy.
commitment. So have a wonderful evening.